So if we use that as the gold standard and we applied that across England, for 15,700 cases we would need 107 thoracic surgeons, and if we looked at the MDT attendance, if we kept the same number of MDTs, we would need 113 surgeons. Now, looking back to that workforce data, if we assume that 63 of those mixed practice surgeons devoted half of their time to lung cancer surgery, which we're not sure that's true, we have a current total of 89 whole-time equivalents. So you can see we are understaffed in terms of specialist thoracic surgical expertise. So the bottom line, if we want to maximise lung cancer resection rates, England needs to recruit 25 to 30 new pure thoracic surgeons. And there are several ways we could do that. We could increase the number of surgeons in training who currently train in both cardiac and thoracic, and increase the number who are specially trained in thoracic surgery and particular lung cancer surgery. Perhaps we could persuade the surgeons who currently have a mixed practice to decide if they want to specialise in either cardiac or thoracic surgery. Failing that, if our authorities don't realise the importance and don't change the training structure, or our hospitals don't realise the importance of our surgeons specialising, we could import new thoracic surgeons from within the EU. But that, of course, would not be particularly acceptable to many of the population or medical specialities. We hear a lot about the developments in new drugs and technology, but I will put it to you that these have borderline effects on the overall survivorship in lung cancer. There is unpublished data as yet to be released that shows that increasing the resection rate has a major impact on the population's survival from lung cancer. And there is data to suggest that if everyone, all the centres, move to the higher resection rate, they could increase survival in lung cancer in England by 12%, which could approximate to over 5,000 extra survivors from lung cancer over a 3-year period. So surgery is still important, vitally important, in the treatment of lung cancer, and the message is specialist lung cancer surgery is even more important. Thank you.
Thank you, Dr. Waller. I think the message was very clear, and the future for thoracic surgery seems bright in the UK. Any questions or comments?
Yeah, Stephen Pinn, Doctors Net UK. The recommendations that you've outlined are very laudable, but given the financial constraints facing the National Health Service in the UK, are they feasible? Would not a cost-benefit analysis of some description help to make the case? In other words, the cost of training and employing more specialist thoracic surgeons against the benefits of an increase in lung resection rates.
So are you asking me how much money the government should spend to increase the survival of patients from lung cancer? I mean, that's not my decision. Clearly, it has to be costed. What is true is that we are training cardiothoracic surgeons, and I'm a training program director. But as yet, there is not a clear direction to us whether we should train specialist lung cancer surgeons or mixed practice cardiothoracic surgeons. The money is already in the system to train those doctors. What needs to be refined is the direction of their training. The question of whether hospitals should or could afford to employ more lung cancer surgeons is a decision obviously I can't take, but what price 5,000 extra survivors?
David, in that respect, is it true that cardiac surgery is a bit on the decline in the UK, and that probably some cardiothoracic surgeons will shift to thoracic surgery?
It is true that the number of coronary bypass operations being performed has reduced as a result of the interventional cardiology. So yes, it is possible that cardiac surgeons have more spare time on their hands, but these are cardiac surgeons who lasted lung cancer surgery many years ago, and there's a possibility they may not have access to the latest thoracic surgical techniques.
Okay. Yes.
Do you have any sense of how applicable these findings are to other countries in the UK about the shortfall in thoracic surgeons?
Speaking to an American surgeon from Salt Lake City last night at the gala dinner, he tells me that in the United States, around half